Hi, I'm Chiranjeev, embryologist at IVF London, and today I'm going to tell you something about time-lapse imaging. Word sounds really fancy, but then it's a very useful tool for the embryologist in the lab. Time-lapse system allows us to monitor the development of the embryos without removing it from a stable incubated environment. So the traditional method of assessment is to check the dish post-fertilization on day 1, then check the cleavage on day 3, and then the blastocyst formation on day 5. And obviously you'll be taking out the dish again on day 6 and day 7 if kept in culture. But with the time-lapse system, the integrated camera and microscope automatically takes images of the embryos every 10 minutes. So it produces a beautiful time-lapse video for all the vital stages of the development. Now this enables us as an embryologist an enhanced assessment of the embryo development. This detailed development information allows us to select, deselect, or probably I would say select the fate of the embryo. If we have some vital points that can get missed in the traditional manual assessment, time-lapse imaging helps us pick up those details and helps us to assess the development of the selection of the embryo, if I must say. So because the embryos remain in the incubator undisturbed, there is no stress induced from outside. So time-lapse imaging picks up a lot of information that is impossible to get by the conventional manual assessment, like the exact time of fertilization, cleavage, cavity formation, the blastocyst formation. In fact, it grazed the blastocyst for us as well. If I can show you how the system works for us, you can get a beautiful panoramic view of all the embryos cultured on the same time. So in case the assessment is missed at one point of time, you can always reel it back and check the development stages, the different stages basically. So a very basic question: who all can benefit from time-lapse imaging, or who must use this technology? In my opinion, every couple seeking this treatment can use this technology. The more information we have regarding the embryo development, the better it is, and it makes it easier for us as an embryologist to assess and select the best embryo for transfer. It surely must be offered to patients with advanced maternal age, like late 30s, move towards 40s, couples who have had experienced recurrent implantation failures or pregnancy loss, just because it helps the embryologist to select the best embryo for the transfer and also pick up little details, as in to see whether there was something that was missed in the embryo development. I'm sure once you ask your embryologist in the lab to give you information about the embryo development, you would find it very, very informative. And it is not only a useful tool for us in the lab, but it also brings a lot of anxiety down for the patients who are seeking fertility treatment, because they definitely want to know what's happening with their embryos once it's injected and how are they developing. So yes, we should make use of this beautiful technology that we have in the lab.